Hello, our names are Samantha, Alyssa, Elaine, and Tara. For our poster, we examined the benefits that mindfulness has on home life. Mindfulness is defined as being present here and now, paying attention to our thoughts, bodily sensations, emotions, and external environment with kindness, non-judgment, and curiosity. The Mindful Child Initiative, or MCI, is a nonprofit organization that teaches mindfulness classes to students in schools within the Lehigh Valley. Their instructors go into classrooms to teach students mindful practices like breathing exercises and mindful movements. Our research question asked if mindfulness has helped me be more happy where I live. This question was retrieved from the MCI survey that was provided to students in the classroom after they had been taught and participated in a mindfulness-based intervention program. Our group decided to define the phrase "where I live" as relating to home life, which includes parents, children, and household relationships.
The overall purpose of this study was to describe the effectiveness of mindfulness practices in the classroom setting. More specifically, we analyzed the question of how mindfulness does or does not make one more happy with their home life. Since we had four team members, we determined four subtypes to individually focus on within this overreaching topic. The four subtopics include the effect of mindfulness practices by parents on familial relationship, mindfulness practices in a low income area, mindfulness parenting, effects on child relationships and outcomes, mindfulness for parenting and of child with chronic illnesses.
So we conducted an integrative review, was performed to find previous studies that focused on mindfulness practice and how it related to home life. We did a comprehensive search of CINAHL, ERIC, and PsycInfo databases. Our main key search terms included mindfulness, elementary school, happiness, attitudes, and stress. We also added limiters to the search to eliminate studies that were not in English, more than 10 years old, and involved students older than elementary school age. We also only included studies that were full text and peer reviewed. We included studies that best related to our individual topics as well. The data utilized for our study was collected by MCI. MCI created a survey for teachers and students to reflect on the effect that mindfulness had on them after they had participated in a mindfulness intervention program. The data came from 6 schools, including 59 teachers and 1,316 students. We had 10 groups within our class. 5 groups analyzed the teacher data, while 5 analyzed student data. Qualitative data was categorized using thematic coding, finding the main themes and sub-themes discussed in the data. The teacher data was color-coded based on common keywords and themes throughout the teacher's responses to the survey questions. Similarly, student data was color-coded based on common feelings and themes throughout the student responses. Themes for the student data included mindful techniques, regulation, and feedback. The quantitative data obtained from the surveys was analyzed using SPSS, which is a statistical software for data management and analytics.
Our group utilized 12 studies that consisted of evidence levels 1, 2, 3, 4, and 6. The key concepts of these studies related to the effects mindfulness has on improving home life. The studies show that parents who practice mindfulness have more beneficial interactions with each other and their children. They show that mindfulness practices enhance familial situations by improving emotional responses to difficult situations and help reduce stress for both parents and children. Mindfulness helps parents and their children to identify more effective solutions to the problems they are facing. Previous studies measured students' perceived stress levels before and after introducing them to mindfulness techniques. The mindfulness practices proved effective by the decreased level of perceived stress after the intervention. Other study results show that mindfulness delivers benefits at both the personal and family levels. They show the significant role of mindfulness at reducing parental stress and anxiety during parent-child interactions.
We analyzed the question of if mindfulness helps one be more happy where they live and used the SPSS software to run descriptive statistics. Results showed that 86% of students who responded to this question answered yes, that mindfulness did help them be more happy where they lived, while 14% answered no. This data supports the literature we used in our analysis because both the literature and survey results show that mindfulness makes people happier within their home life by improving stress reduction and relationships between families. Mindfulness improves communication, relationships, emotions, and reactions to situations. Limitations of this study include that our group was not able to observe the MCI data collection or member check that our themes resonated with the survey participants' feelings. The survey responses are a snapshot of one point in time, so it is important to tell whether the surveys were accurate or the results were skewed due to participants' external related human emotions affecting their responses to the questions. Also, participants may not have cared to accurately answer the questions or may not have had the vocabulary or ability to describe their true feelings. It is unclear how representative this sample was due to the fact that it was de-identified before we received it, and no information on demographics was provided. Implications for nursing include that nurses can utilize mindfulness techniques to improve their own emotions during and after stressful situations within their workplace and personal lives. Mindfulness can help improve interactions for nurses, both between their coworkers and their patients, for more open communication. Nurses may also benefit from teaching mindfulness interventions to their patients and their families to better emotionally regulate and communicate during trying times to improve patient health outcomes. More research is needed to further understand the ways in which mindfulness could potentially improve outcomes for overall health and well-being, especially in a healthcare setting, when utilized by patients, their families, providers, and other healthcare staff.
To wrap up, mindfulness has been shown to have multiple benefits in many aspects of life. Specifically, in our research, we found that mindfulness improves home life by enhances familial communication and emotional regulation, specifically during difficult situations. When we use when we use by both parents and their children, utilizing mindfulness techniques and can improve communication and provide stress reduction, leading to overall better outcomes. Lastly, we would like to give a special thanks to those who supported and guide us throughout this research process, including Dr. Janice Fiber, Dr. Karen Goulet, Chris Pitt, Derek Ashe, Jason Sizemore, and Sarah Martinez.